Hello, we are here at the WFNR-EFNR Regional Meeting in Baku, Azerbaijan, which is jointly organized in conjunction with the 19th Congress of the Society for the Study of Neuroprotection and Neuroplasticity and the 19th International Summer School of Neurology with Professor Paola Marongolo. Professor Marangolo is a neuropsychologist and full professor in neuropsychology and cognitive neuroscience at the University Federico II, Department of Humanities Studies, Italy. Firstly, dear Professor Marangolo, could you comment on the latest development in the field of speech and language therapy?
Sure. So we know much more than before. I started, let's say, 40 years ago, and when we started, we didn't know that one of, let's say, key predictor of recovery, in general, of cognitive recovery, but regarding aphasia is very, very important, is the intensity of the treatment. So today we know that it's much better to provide the patient, let's say, hours of therapy every day for, let's say, 1 month, than providing them just once or 2 times a week for 12 months. And this is a very, very important issue, because if we know that intensity is the key predictor of recovery, then what we have to do is to provide patients with an intensive treatment. What can we do? So I think we should first of all, thinking of very simple devices, and this is a new approach to aphasia, that in some way can help to boost the recovery process. And this very simple device should be costless, that can be also delivered at home, because if we want to provide these patients with intensity, what we have to do also is using simple devices which boost the recovery process, such as, let's say, neuromodulations. And there are some very simple devices like TDCS, transcranial direct current stimulation, that could be also delivered at home. But also what we have to do, and this is very, very important, is to involve family members in the treatment plan. And this is another new thing, new approach, because at the beginning, when we started, let's say 40 years ago, when I started approaching aphasia, speech therapists were the only one who could provide the treatment to the patient, and this cannot be done anymore. We need the family. The family should help us to guarantee the patient the intensity of the treatment. This is the new thing we now know.
So, what are the state-of-the-art elements regarding pharmacological and non-pharmacological interventions in treating these conditions within this medical field?
Regarding pharmacological intervention, as we already also heard at the conference, I agree that we don't have elements to say today that we can use drugs to pharmacological treatment to improve rehabilitation in aphasia. What we know right now, I mean, the results are very contrasting. There are contrasting results for pharmacological intervention. What we know is that some drugs can work if they are administered during the acute or subacute period, and if they are combined with speech therapy. But the data are a little bit not so clear right now. So I don't think that we have today published results which speak in favor of pharmacological treatment. For non-pharmacological treatment, we have several evidence-based treatment for aphasia, which have been proved to be very successful, such as one of the most famous one is the conversational approach, which it's is an approach which I really like. Is a pragmatic approach, which is based on a natural conversation between the patient and the therapist. And what I like of this approach is that the therapist has always to adapt himself, herself, to the patient's speech or to what the patients respond. So nothing is structured, nothing is already structured. It's something very natural, and there are some other evidence-based treatments, such as another one is, we have a lot of treatment focus on the improvement of different impairments that can be seen in aphasia in some aphasic patients, such as the semantic approach, which is focused on improving the ability of the patient to understand the concepts of the words. And it's very, very important, because another thing which has been, I think, neglected in the past was that we focus our intervention much more on the production of the ability of the patients to produce speech, and in some way we neglected that the most important thing is to understand language. We first have to understand, and then we can produce. We have to plan new treatment for enhancing comprehension abilities in the patient, and one of these is our methods based on improving semantic memory, so the ability to understand the concept of the word. So if I know the concept of the word, if I know the concept of, let's say, chair or sofa, then I can say sofa. I can produce the word, the correct word. The big problem in aphasia right now is that all of these treatments are not so much ecological based. Another aspect which should not be neglected in the future is that when we train our patient, then the patient will be discharged from the hospital, he will go home, and he needs language to communicate in everyday activities. So our approach should be as much as ecological as possible. This is another aspect that I think is very, very important.
So a comprehensive and multi-level approach to the pathology.
Yes. And let's say I very like the idea of moving from a very structured, constrained approach to a much more natural approach, let's say pragmatic approach. Pragmatics is based on, the pragmatic approach is based on the use of language in different contexts. So language, we should learn, we should teach this patient to use language in different contexts, not only in therapy. You understand what I mean?
Yes. So, from your research experience, could you share with us several main results obtained from treating patients with post-stroke aphasia?
Absolutely, yes. I mean, we can think of, we can plan module teaching courses where we can speak about all of these evidence-based treatment. But what I very much like to do, if it's possible, when I teach in this aphasia module, what I really like is to, I think the best thing to understand how to approach this patient, how to improve their abilities, is to see patients together, to work together, if it's possible, either with patients in present or through videos. I would very much like if we can put our theory into practice and see patients together and discuss about patients either in presence or maybe through video recordings. Yes. This could be very useful, I think.
Mm-hmm. And for my last question, what do you think would be the added value of this teaching course in Central Asia, and how could it be capitalized at the local level?
So I think that what we can do through this teaching program is to improve the healthcare system. It's very important to early recognize the symptom in order to provide the patient with a therapeutic program. So we can train healthcare professionals in understanding immediately what is going on with very, very simple protocols protocols, very, very simple tests which could be shared in different countries. We don't need too much things. We just need very, very simple protocols, and we can share this protocol in different countries. Let's say some protocols to let us, to let healthcare professionals to immediately understand which are the symptoms that should be immediately trained through, let's say, very simple testing. And one of the most important symptoms is if the patients understand what we are saying. So there are any comprehension problems, there are any production problems, and so on. And then build up very simple protocols, rehabilitation protocols, which could be shared among the different countries, and maybe based on this idea of conversational approach, because this would let us to adapt the protocols to the different languages. Another important aspect which I think should be done locally or in Central Asia, let's say, could be to have program to support families. Because in this way families can help us, as I said before, to provide intensive treatment. So this is a very important thing. Also community-based program. So program for healthcare professionals based on the idea of improving the ability to diagnose aphasia, and then have best practice for aphasia recovery. And on the other side, also community-based program for families and patients and caregivers, because this is another very important aspect.
All right. Thank you, Professor Marongolo.
Thank you
for being here.
Thank you very much. I really enjoy to be here. It's a very, very interesting conference, and I think that this idea of promoting cognitive rehabilitation everywhere, let's say in the world, in Asia, in East Europe, it's one of the most brilliant ideas I ever listened to. Thank you.
Thank you.